So since I attended CIT training 3 years ago or so, I've used it a lot in the field to get people to talk to me, to get people to comply with what I'm asking them to do, to get people to feel comfortable with me. One specific incident I can think of was earlier this year we got a call from a local neighboring agency wanting us to check the welfare of somebody that they had information was possibly suicidal. They had sent text messages or had a phone conversation with their boyfriend that they were going to kill themselves. They had what's called ping the phone to try to get the location of where the person was, because they didn't know exactly where they were, but after the ping, they found that she was out in a small town out in the western part of the county. So I went out there, drove around the area. I actually found her car, but she wasn't anywhere in it. So I tried calling the phone. She answered, but she did not want to talk to me. She was angry about the situation, angry that we were out there looking for her, didn't trust the police, didn't trust men specifically because of past experiences. She wouldn't admit to making any types of statements, said she was fine, just to leave her alone. And I kept reiterating to her that all I need to do is to have a conversation with you face to face so that I can make sure that you're safe and for your own good and for my own self-conscious as well. So, but she just wouldn't tell me where she was. She was on foot somewhere in the area. So I probably spent about 20 minutes speaking with her on the phone, trying to get her to tell me where she was. Finally, she agreed to give me a vague location of where she was, and one of the other deputies that was in the area actually found her. She did not want to talk to anybody else except for me for whatever reason. She didn't want to talk to me, but if she had to talk to somebody, she wanted to talk to me. So the other 2 deputies that were there, she did not want to speak with. She said if they come any closer, she was threatening their safety and all that kind of stuff. So at that point, I felt comfortable just talking with her one-on-one with the deputies back, so that I could still have that same rapport with her, so I could speak with her and kind of get an idea of how she was feeling. I spoke with her for probably about another 20 minutes or so before I finally made the decision that she needs help. She did admit to making the suicidal statements, so I made the determination that she needed to go to the hospital to get some help. My next hurdle I had to get over was getting her in my car and driving her 45 minutes to Indianapolis to get her to a hospital. And I thought, the entire time I thought, it's going to get to a point where I'm going to have to put my hands on her to get her into my car, and that's the last thing I want. Someone who's actually sick or going through crisis to go hands-on with somebody. If it's an officer safety issue, great, but if we can avoid it, I would much rather avoid that. So I got over that by using some of the CIT skills that we were taught. I tried to be as patient as I could, tried to convey to her that I actually did care about her and wanted her to get some help. I tried to, if there was any type of leeway I could give her, whether it's letting her make a few phone calls before she left, or smoke a couple cigarettes, whatever the case is, as long as it didn't compromise my safety or violate policy, I tried to give in on those things. Tried to give her a little bit of input in how the situation was handled. I also tried to explain to her everything that we were doing step by step, that you're going to go in my car, we're going to drive to the Indianapolis, we're going to talk to the doctors there, and what the steps were going to be moving forward. So by the time we got to the hospital, she was still angry and she was still argumentative and all that kind of stuff, but she wasn't violent. And I had gotten to her to that point without having to go hands-on with her, which is a win. We got her to the hospital and the same type of behavior continued, so I went back inside the hospital room and tried to explain to her the reasonings for all those things and the why behind it. Instead of just giving her an order to do something, I tried to explain to her the why behind it. And it eventually got to the point where she calmed down, got changed, took a nap, and I was able to leave her a good